Welcome to Invest Insights. I'm Abby Melone. I'm joined today by David Pizzo, the Market President of West Florida for Florida Blue. He joins us for our discussion on the COVID-19 pandemic. Don't forget to like this video and subscribe to our channel for more videos like this. David, what has the crisis revealed about the possibilities and potential for telemedicine? I know it's something that Florida Blue had already been implementing, but how has the crisis propelled telemedicine to the foreground? And what other technological solutions do you see COVID-19 pushing to the foreground?
Well, thank you, Abby, for a question. I think that's one of probably the more important questions. If we actually look at in a very negative situation with COVID-19, the crisis, the pandemic, what are some things that have come out of it where we've learned as a society and even as an organization too? And I would say telehealth. This situation has ramped up telehealth in a big way. So it's really become a viable option. We at Florida Blue have had telehealth for a while now. We use our partner Teledoc for that. What we've done with this crisis, though, due to some direction from CMS for government, we've made it available to all of our Medicare members at no copay, and it is available to virtually all of our Florida Blue members on the group side and individual side with no copay. So that's been a shift, and we encourage people to use it so they don't have to go to the doctor. We want people to really access the healthcare system, even if you can't go in for a physical appointment. But we've seen usage ramp up quite a bit, and even on our behavioral health side of our business, we've seen quite a few contacts claims for use of the virtual service. I think as people become more comfortable with this during the crisis, they'll be more apt to use it afterwards as well. So significant usage from telehealth these days.
Great. And the crisis has shown light in many, on both the positive and the negative aspects of our healthcare system and our insurance system. What has stood out particularly to you about the industry, and how might it be reshaped as we move forward through recovery?
I would say COVID-19 has changed everything. It's really got us to rethink a lot. I mean, even our own company, we switched from, being a company that had, a fair number of remote workers or people working in, lots of different offices, but we went virtual in a very short period of time. And I know many other companies did, but we were one of the earlier companies to shift our employees to about 95, 96% working at home. So we could service our members and providers without a glitch, and that's worked extremely well. So we've had to rethink a lot of things. We had to act swiftly, working on the actual health side of this in terms of testing. There's a lot out there about testing, but we were one of the first companies to approve no charge testing for our members, and we've migrated soon after that. We moved to zero cost sharing for treatment of COVID for a specific period of time. But we've been very active on the educational front as well to inform our millions of members about what's available. We'll have a website I can talk about later, resources, but we've got a lot of information. I can tell you it's really enveloped all of our team members every day, where we actually think through what are we doing to help solve this situation. One of the biggest issues right now are so many people losing their positions or being furloughed, and they also could be losing their employer-provided health plans. So we've had a tremendous educational effort in many ways to educate employers, agents and brokers, and even the general public about options. Because even though you may not be able to afford COBRA on your health plan if you were displaced, and if some employers are continuing to pay for the benefits, which is great, but if not, we really want people to contact an agent, contact us directly to find out if they qualify for a subsidy, because a subsidy through the Affordable Care Act, or Obamacare as many people know it. But given the change of employment, or even if employment is similar, particularly for self-employed people or early retirees, if there's a change in income, they actually can qualify for possibly a larger subsidy. So one of the most important things we urge employers to tell displaced employees or just the general public, if you're not certain about being able to keep your health plan or affording it, please contact Florida Blue agent, Florida Blue Retail Center, broker regarding what option you have, because there are many, many options now.
That's good information indeed. And I know that you've been working with federal officials, state officials, local authorities. In what ways are you collaborating?
Yeah, we're working, many of our executives are working at lots of different levels, between Washington and the state, county, city. Again, like I said, it's got many of us really engaged at lots of activities. Personally, right here, I'm very involved in the Tampa Bay Partnership, an 8-county business advocacy and policy group. And this has been top of mind. Every few days, we publish a newsletter with really important new data that's very helpful for the situation. We have a biweekly survey that is produced every other week. It's a sentiment survey on this, so we can really keep a pulse on what people in the market are thinking. And we supply that to well over 1,000 executives, elected officials, people in critical jobs throughout the region, to inform them of what people are thinking and doing. So we try to get ahead of the curve on some of the data and information, but that's through the partnership. But we're working, again, federal, state, county, city levels, what we can do. One of the things that we're working on particularly is that there's so many uninsured. And before this crisis, there were over 3 million uninsured people in Florida. Over 27.5 million in the United States. And these numbers are really skyrocketing. So one of the things I mentioned before, we really urge people to contact Florida Blue or their agent broker if they have questions, concerns. We can provide education, navigation, and advice on that, or our agents can. But one of the things we're really trying to do is to help bring the costs down for younger people, and particularly in the, I believe it's the 21 to 54 age group. It actually costs significantly more in the Affordable Care Act, the way it's structured, than it used to before the Affordable Care Act. So we're supporting some legislation by a couple of Florida House representatives in Washington to help make an adjustment, not to increase the overall cost of the program, but to make an adjustment so younger people in the age 21 to 24 can have more affordable coverage through larger subsidies. And we think that would make a huge difference and could bring in, possibly cover, 2+ million of that 3+ million that are uninsured. And again, that number is going to be much larger given the significant unemployment at this point.
Absolutely, and affordability is definitely on everyone's mind, but another thing is food stability. Many people find themselves disenfranchised. The food banks are not receiving the amount of food that they're normally receiving, and yet Florida Blue has been donating food to help those struggling in the Tampa Bay area. Tell us a little bit more about this initiative.
Oh, thank you, Abby. That's a great question. And that's one of, I'm going to say, our company's passions. We're actually a nonprofit structure. We give significant amount of our profits back to community organizations. And just now, as a result of this crisis, we've made an initial investment of $2 million to address some of these urgent and immediate needs, safety needs, food security, and others, and including areas in behavioral health and others in local communities. Just here in Tampa Bay, a couple of things that we've been doing, we provided over 500,000 meals to through Feeding Tampa Bay, adding to the $750,000 that we announced earlier this year for the program. So we had been supporting unique programs of Feeding Tampa Bay already. We just helped add to that through this crisis because the need is greater than anyone's seen before. We provided $100,000 to the 3 area YMCAs, over 20 facilities, to help reduce the cost of youth care for essential frontline workers. So instead of paying $50 a day, frontline workers, nurses, physicians, et cetera, EMS workers, et cetera, goes from $50 a day to $10 a day. And that's been a hugely successful program to keep our essential workers in the field helping patients. We provided $75,000 to several organizations focused on supporting the needs of the senior population up and down the coast, all the way from this area of Tampa Bay all the way down to Collier and Lee counties. United Way, big support of United Way through their Suncoast Disaster Relief Fund that supports quite a few counties, and even some of our regular partners like Metropolitan Ministries and the Crisis Center of Tampa Bay. We provided some significant grants. So a lot of things going on, and this is in addition to the significant work we're doing. In addition, I want to say, and this is really important, when this crisis first hit, Florida Blue launched a 24-hour free emotional support helpline for all Floridians through our behavioral health partner, New Directions. And that's available. Anyone, not just Florida Blue members, literally anyone in Florida can call 833-848-1762 for support in managing feelings of stress, anxiety, anything related to COVID-19 pandemic. There's counselors standing by all the time. And our Florida Blue centers, as you know, we have about 23 of them throughout the state. While they're not open physically, they are opened in a virtual sense. So people living in the different communities, like right here in Tampa, Sarasota, Pinellas Park, can call the number. It's on our website. And they'll actually speak to the people in their neighborhood, whether it's a sales rep, a nurse, a service rep, and even we have counselors, social workers at each of our centers that can help guide people to different resources in the community. And that's been a huge hit. We staffed that in the last year. But again, that's available for anyone. You don't have to be a Florida Blue member to use that service.
The safety net is important indeed. And should people want to find out more information about all the many programs that you have, where would you direct them?
I would say the best place to go is our website. They can go to floridablue.com/COVID-19, and that's filled with resources. It's not just for members, it's the general public. That's updated practically daily, and it's just a great place for data, information, and lots of other links to get to. So I would say that's one thing that's good, that's on there. There's also a wellness assessment tool on there, so they can go in and enter certain symptoms that they have that'll guide them through artificial intelligence of what they should do if they have the symptoms of this, or maybe it's not. So that's a valuable tool we've gotten good feedback on. There's also a testing site locator, so you can actually look up in your community where the local testing site is and then connect to them on what you have to do, because in many cases you need appointments to go in. And I mentioned our Florida Blue centers. You can go to floridablue.com and go to our website and just find out where the local centers are if you want to talk to your local nurse, or again, some of the people I mentioned earlier. So some great resources available to people throughout the state.
Great. Well, thank you again. That was David Pizzo, the Market President for West Florida for Florida Blue. Don't forget to like this video and subscribe to our channel to watch more insights like this. My name is Abby Melone, and you've been watching Invest Insights. Thank you.